Melanoma, also known as malignant melanoma, is a skin cancer that develops from cells called melanocytes. These cells multiply out of control, forming a cancerous or malignant tumor. The skin is a large and complex organ that serves to protect, provide sensation, and help maintain the body's internal temperature. It is comprised of 3 layers: the epidermis, dermis, and hypodermis. There are many different cell types that constitute the skin. The melanocyte is one type, located in the bottom layer of the epidermis. Melanocytes are responsible for producing melanin, a pigment molecule that provides the skin its color and protection from ultraviolet or UV light. Also located in the skin, with important roles during melanoma development, are blood vessels and lymphatic vessels, which are special vessels that help drain tissues and organs. While melanocytes and melanin help protect the skin from UV light, this type of light is the main cause of mutations in the cellular DNA, the cell's genetic material, triggering these cells to become malignant and form a melanoma tumor. Other risk factors include immune suppression, age, a large number of existing moles, light-colored skin, and family history. Minimizing exposure to sources of UV light, such as the sun and indoor tanning beds, and applying sunscreen are important factors in protecting oneself against melanoma, since treating melanoma once it starts can be complicated due to its growth pattern. Melanoma growth and development have 2 distinct phases. The first phase is one of horizontal or radial growth, where the tumor cells divide and spread along the epidermal-dermal border and into the upper portion of the dermis. During this phase, the tumor does not metastasize or spread beyond the skin. It is during the second, vertical growth phase, that the tumor grows deeper into the dermis and hypodermis, and the cells may begin to metastasize. This is when the cells spread and often enter a lymphatic vessel to be carried to another part of the skin, establishing a satellite melanoma tumor. Meanwhile, these cells can also travel to a regional lymph node, establishing a tumor within the lymph node known as the sentinel lymph node. The tumor cells may also metastasize by entering a blood vessel, where they can travel within the bloodstream and migrate to a distant organ, establishing a metastatic melanoma tumor. When a doctor discovers a mole or lesion that appears to be a melanoma, a biopsy will be performed to accurately diagnose the suspected lesion. There are 3 biopsy techniques that can be used, depending on the lesion that is present. These are a punch biopsy, a shave biopsy, and an excisional biopsy. After the biopsy is performed, the sample is analyzed by a pathologist, a specialist that studies disease processes. If the diagnosis shows that there is a melanoma present, the doctor and patient will discuss the next steps, including the appropriate treatments. Therefore, it is important to monitor the skin so that potential melanoma lesions can be diagnosed and treated in their early stages before the tumor can spread or metastasize.